Thank you, Chairman. Thank you, everybody. Good afternoon for all colleagues. Before to start, I would like to thank Professor Ayman for this for organization of this excellent meeting and giving me the opportunity to talk about particular team, which while abdominal DVT, while it's not frequent if we compare it with deep leg venous thrombosis, but the particularity of this localization is that this will be a problem of first sign of prothrombotic state. And abdominal DVT, it's a cause of morbidity, a real cause of morbidity, because it's possible that life-threatening form of venous thrombosis. It includes the particular localization, hepatic vein, and the portal vein thrombosis, and the mesenteric vein. The aim of our study is to describe its clinical and etiological profile. What about the method? It's a single-center retrospective study involving 246 patients with DVT enrolled over a period of 11 years. We looked systematically for patients with abdominal DVT. The diagnosis was focused on imaging, ultrasound, Doppler, and the CT or MRI. All patients underwent an exhaustive etiological investigation, clinical exam, blood test, particularly congenital and acquired thrombophilia, bone marrow aspiration, and biopsy. What about our results? 172 patients with abdominal DVT were identified with a sex ratio of 1 and mean age of 44 years. The first sign which led to diagnosis was abdominal pain in 7 out of 10 patients, followed by abdominal distensions in 16%, and for a lower frequency, it cites decompensation and cholestasis syndrome. Localization, it affects portal vein in 70% of patients, and suprahepatic vein. What about etiologies? Etiologies were dominated by myeloproliferative disorders, congenital thrombophilia, antiphospholipid antibodies syndrome, and oral contraceptive use. What can we do? What can we say about this observation? The first symptom for all the series in the world is pain, abdominal pain. It's classic. What about localization? For VALA, if we compare this data in the literature data, for VALA, the first localization, the predominant localization, is hepatic vein. For CONDAT and our series, it's portal vein. If we compare this data about the etiology was dominated in all the series, often in the literature or often in our series, by myeloproliferative disorders, congenital thrombophilia, APL syndrome, and oral contraceptive use too. We can say that a splanchnic vein thrombosis represents, according to the series of abdominal DVT, a consequent percentage of all cases of DVT hospitalized DVT. The both territories which was affected, hepatic vein and spleen and hepatic vein and the portal vein, share many risk factors of thrombosis. And for Proliferative disorders and APL syndrome are, like in our series, the most frequent cause. In conclusion, this unusual entity, splenic thrombosis, remain a reason for hospitalization in internal medicine because of prothrombotic state in these patients, which need exploration and anticoagulation. Thank you for your attention.